Tim McLaughlin. So Ken Janoski is our guest today. He is a full-time employee working with Mary Beth Thomas at the North Carolina Biotech Center. Can I get a show of hands of how many people have actually been to the Biotech Center? Okay.
Oh, that's more than I would have
most of
expected.
everyone. This, most of the people that I talk with don't even know that there's a physical office. The Biotech Center is a very powerful organization. I am a former employee of the Biotech Center when they had the Center of Innovation for Nanobio. They have offices across the state of North Carolina there are 6 or 8 different offices.
There are 8 different offices,
yeah.
Regional offices.
Ken comes to us as a past, or I may say reforming, serial life sciences entrepreneur. He has been an active angel investor. He has his company called Guidance Ventures. He has also been an SBI reviewer, a grant reviewer on phase 2 SBIR Grants, and been an active member of the Angel Capital Association. So you can see why this is a very good fit for what we're doing here. He has played on every side of this industry as being an entrepreneur and an investor, and now as a kind of a nonprofit supporter of entrepreneurship. So please, everyone, welcome Ken. So my first question is, tell us about your background as an entrepreneur. What were the types of companies and what were the result of those 3 startups that you had in St. Louis?
So this is my log cabin story, I suppose. I've been very interested in science all my life, but I was not trained as a scientist. I actually went to school for business, but I've been involved in running science-based companies throughout my profession. Oh, you are? Okay. My professional career has been in and around science-based companies. Either early on, I ran a chemical company, we sold that business, decided to go back and get an MBA, and from there I was trying to decide what to do with the rest of my life. I joined Anderson Consulting, which is the forerunner of the current Accenture, and that took me around the globe. I traveled all the time. Never really lost my love of being around entrepreneurs and small companies. And after 5 years of doing that, I decided I needed a change. I very consciously made a decision that I wanted to go back into being an entrepreneur in the life sciences. And without having a background in science, life science, education that is, I actually had to spend a lot of time learning the jargon, learning the lingo, learning what are the important topics in life science. And why I chose life science versus technology is that I also felt I wanted to do something a little bit more, make a little more difference than perhaps another Facebook or anything like that, that it perhaps, somehow help overcome some diseases and so forth. So there's a very conscious effort. And I think people in life sciences, all entrepreneurs, everyone involved from medical professions, that's one of the underlying themes that we shouldn't really forget, that ultimately they have an altruistic motive behind some of the things they're working on. With that said, I got involved with University of Georgia, several other universities down there, and got involved with startups down there.
I'm a Gator. We just don't get along. Okay. You're a Cardinals fan, I'm a Cubs fan, I'm a Gator.
From there I also got involved with Emory University. So I lived in Atlanta for about 25 years. While in Atlanta, I got involved with Emory University, Georgia Tech as well. And also got involved in the venture capital world. And so over my career, not just 3 startups, over my career even today, I've been involved either as an investor, a co-founder, or an advisor to at this stage, well over 30 different life science companies. Everything from
30,
yes. Everything from therapeutics to medical devices to health IT. Now, some of those roles have been as involved from as venture capitalists making investments, sitting on boards. I've been the chairman of the board of 4 different life science companies, board members on another 3, so 7 life science companies. At the center, I work for the North Carolina Biotechnology Center now, and so I make investments. We make loans into life science companies, and so far I've done 3 different loans to 3 different companies to try to help them get started. So I've added those all together on all of the companies that I've been involved in. So very early stage companies is what I typically have been involved with. And I'll talk a little bit more about the center.
Well, I have a lot of questions.
Okay, go ahead.
All right.
Sorry.
So
You can tell I'm a bit long-winded.
that's okay. That's all right. So from St. Louis, you went to Atlanta, and now you're here. One of the things on your LinkedIn bio talks about an organization called BioGenerator, which is in your LinkedIn description is venture philanthropy. Does anyone here know venture philanthropy? Maybe a local company that has received capital from venture philanthropy. Preston, which company?
I can't name
Liquidia. Liquidia got money from the Bill and Melinda Gates Foundation as an equity investment, not a grant, not a loan, but it was an equity investment from a nonprofit. So can you talk about maybe where...
What BioGenerator was.
Yeah,
Okay.
and where it is today? Is it still alive?
BioGenerator is very much alive. So BioGenerator is, and I'll change it just a little bit. It is a venture philanthropy, but it's an organization very similar to the current North Carolina Biotechnology Center. The North Carolina Biotechnology Center receives money from the state of North Carolina as a nonprofit, then it in turn puts money into universities in the form of grants supporting proof of concept, translational stage, life science technologies. And then my group, what we do is we put money in the form of loans into early stage companies. But it's all from the state of North Carolina, and so we just funnel the money back out into the community. If there is a return on our loans, when they're paid back, the money is just redistributed. It goes back to a pool, so we redistribute it back into the state of North Carolina. BioGenerator is the same way, except for it didn't receive funding from the state of Missouri instead, and this was in St. Louis, where I'm originally from. And instead, it received monies from 2 of the largest, wealthiest families in St. Louis, and that was the Danforth family. Bill Danforth, if anybody is aware, was the former chancellor of Washington University, and that he is also heir to the Ralston Purina money. You've all seen Checkerboard Square and all of that, Rice Checks, Reach Check, and all of that. So the Danforth money went into my organization, as well as the McDonald family, McDonald of McDonnell Douglas, which is now part of Boeing. So those 2 families were very interested. How that evolved is that in St. Louis, those companies, Ralston Purina was sold to Nestle's, and McDonnell Douglas was sold to Boeing. So those companies that were pivotal to the success of the region in the St. Louis were now acquired by larger companies. So those 2 families really felt an obligation to try to help the region develop its life science base.
And what year is this?
And that actually was in I'm trying to think the exact dates when that got started, was probably around 2003. I joined in 2005. And the idea with the money that we received from that went into the BioGenerator was to make investments into early stage startups in St. Louis. Now, if anybody's familiar with St. Louis, I know you are, it's not exactly the hotbed of entrepreneurialism. It's really a big company town. Everybody worked for Anheuser-Busch, or they worked for Boeing or McDonnell Douglas and so forth. So one of the tasks that we had to do was spend a lot of time trying to create these startup life science companies, trying to find entrepreneurs. So we spent a lot of time also doing education. But the difference between the center, what we do, and on a larger scale, what we currently do, is that the money comes to the state, and the case of BioGenerator, it came from, some of the civic community, if you will, that went into helping the company. And it was an evergreen fund, so as we were successful, the money came back into the fund, the BioGenerator, and then we could use that to reinvest it again. Since then, the organization has really expanded. It is now getting dollars. That it's all part of a larger umbrella organization in St. Louis, and it is getting dollars in the state of Missouri, and it has, for that region, has been a very successful institution.
Let's move on to the Biotech Center. The reason Ken and I connected is, you may remember an entrepreneur presented at the RTP Frontier, Erica of Beesbury, and she had all these questions about HIPAA rules around IT, health IT, and so I connected with the Biotech Center. Mary Beth connected me to Ken. So here's a very quick question. Is the goal of the Biotech Center to create more startups in the life sciences, to grow more jobs in the industry, or is it to support existing industry and grow that? I mean, I know that there's a combination of that, but what is, if one has a higher percentage, is it more about the startups or the existing companies?
So my simple answer is yes, all three. And actually that is something that we wrestle with in the center. On one hand, our mission is really try to grow our overall mission is to try to grow the industry here in the state of North Carolina. That means a lot of different things. That can be more startup companies. It could also mean more successful research institutions who now generate more ideas, concepts that could be utilized by our existing companies or startups. It also means, how do the existing companies, how can they be successful so that there's a greater awareness for the state of North Carolina's capabilities in the life sciences. So we struggle with even though it sounds like we have a lot between our grants and our loan program, it's about $6 million. It sounds like a lot on an annual basis, but it's still, our loans get used up, and we feel like we just never have enough to put it to work to help companies grow. So ideally, what we really want is to see success. We want to see jobs created, but we recognize that in the life sciences, they're really high-paying jobs. So there's going to be fewer of those actually created. So likely fewer, our statistics is not so much how many jobs, but how many jobs, what's the pay, the overall payroll for those jobs is what we're really looking for. And again, that increases the tax base, which increases education and has a multiplier effect on the state of North Carolina.
So I think some people, maybe even in this room, but especially in other areas outside of the triangle, the word North Carolina Biotech Center kind of maybe doesn't explain the breadth of what you guys do. So you do medical devices as well, pharma as well, but I think a new focus is ag tech or AGBio. Can you, maybe that's not your background, but can you maybe explain to, our last presenter in this room was Measure.io, which was an ag tech kind of company. So what are the new assets of the agriculture bio area?
So what we do at the center, yes, the name is North Carolina Biotechnology Center. What we do is something called technology-based economic development. Throughout the state, throughout the United States and across the world, there are organizations very similar to us who do technology-based economic development. The idea is using public monies to try to create a technology infrastructure. And the technology can either be typical what we think, IT, chips, those kinds of things, as well as life sciences, medical device. So for us, you're right, we were founded 35 years ago. We're actually going to celebrate our 35th anniversary in September, October, I think. Our organization is one of the granddaddies, if you will, or grandmothers of this kind of activity, technology-based economic development. Maryland also had another group very similar to us. We've been very, very successful. Other states have come and copied our model and have made some adjustments. Matter of fact, BioGenerator, when I was at BioGenerator, I actually made a journey back over here. I knew the folks at the center to try to understand better about what the center was doing at that time.
Would you say
and
that,
steal those ideas back to Missouri.
And Georgia too.
And Georgia as well. Georgia Research Alliance is also renowned for success in technology-based economic development. So what we try to do, so initially the focus was on biotechnology, because 35 years ago, some of the core companies that we had here, I think we had Pfizer was one of the, Glaxo. A lot of those companies had some really a big footprint, big presence. So we were, the Research Triangle Park, we were located in the Research Triangle Park with the whole idea of, biotechnology, genetic engineering is going to be the future. Let's see if we can't develop our base. Of course, over time, that has evolved on what it really means, biotechnology. Everything from now gene editing to more broadly, as you were saying, we include medical devices because we've seen that folks are developing a lot of wonderful medical devices here in the state of North Carolina. How do we support that? So we do that. We dip our toes a little bit in the health IT. And one of the reasons why we do not do health IT, in my past I've done it, is that we generally feel our money should go towards technologies or places that have a more difficult time raising monies. Health IT, this is my personal opinion, I think there's a lot of appetite by investors, even in this room, who are willing to put money into health IT, whereas therapeutics, even as I, as an angel, would kind of push back. It's just very, very hard on doing that. So our money tends to go towards those more challenging technologies. So if we were to do, we have done a health IT, a company recently called Higgs Boson Health, which is really more healthcare patient management technology system. But if we were to do more of that, it's likely to be more along the lines of using artificial intelligence for drug discovery, machine learning, and all of those kind of things. How can this be applied towards some of the more harder sciences, if you will?
Okay, I have one last question before we open it to the audience. I was 2 weeks ago part of an event in Wilmington on SBIR grants. You've been a reviewer for phase 2 of SBIR grants. Their slides said that the SBIR grant is a good fit between the angel investors, the SBIR grants, and then the venture capital. Is that the succession that you see, or do grants play a little bit earlier role?
I tend to think it all depends on, it
Take precedent anywhere.
It depends on the technology is how I really think of it, is that I think if you're talking, let's just use therapeutics or gene therapy, anything like that. I think there's less opportunities for angels to be involved. I mean, they could if they want, but I think the risks there are very high for angels. So if you were talking about that, it would probably be grants would be a significant portion of what those companies are relying on, followed by venture investor or even strategic investors, which now are becoming much more important in the life science world. Strategic investors meaning the Amgens of the world, the Merck of the world, they all have their corporate venture arms that are now coming in and actually making investments. Recently, we've had an example of Ribometrics here in the park that has received dollars from AbbVie, Amgen, Merck, and a number of other strategic investors. So I think it depends on the sector.
Okay.
If it's an agricultural, ag tech play, that actually may be ripe for angels to be involved in as well.
Okay, any questions from the audience, Krissa?
I'll start with everybody question. And what do you see in terms of the partnering between startups and established organizations, corporations? Are you envisioning a matchmaking kind of role as well to try and pair those two entities?
So we're trying to do more of that. We have done to a certain extent. To a limited extent, we've tried to help the companies develop relationships with the other existing established companies. And we do that through holding events, networking events, but that's kind of almost, here's an event, let's do some collisions and, you know, luck of the draw. As we kind of think, and you and I had talked a little bit earlier, one of the issues that I'm seeing as someone who's relatively new to the area is the challenge for our life science companies to raise the Series A. Yes, they can raise Series A a small amount of dollars, say. To me, a Series A is impactful money, 10, 20, $30 million, a significant amount of dollars. But unfortunately, I've seen a lot of our companies will pursue a round of $3 million. It's meaningful to them, but I think they really just think this is all they're going to get. They can actually target that dollars, and that's all they're going to get. And what we're thinking about now is how to help them think bigger, if you will. Chris and I were talking earlier that in life sciences, frequently at the very early stages, the companies, the co-founders are really focused on the technology, developing proof of concept, perfect. But they tend to neglect some of the other key pieces to make them a more credible Series A candidate. Board of directors, do they have a very credible, knowledgeable board of directors that can actually bring some credibility to their technology? Scientific advisory boards, frequently we see it's just friends, you know, of the researcher, instead of some really outside constructive thinkers that could really help them develop. And it's things like that that I think we, the center, are very interested in working with folks like you. We don't have all the answers, the community does, and how do we really kind of work with everybody to try to help these companies get better connections and develop so that they're much more successful in the long run.
Any additional questions?
Well, I was going to just add one final comment. We participated in Startup Fest Europe a couple of years ago and saw how the matchmaking was much more intentional between state organizations. Now, in Europe, there's a stronger, let's just say, federal component to that in terms of matchmaking for economic development. But it could be that you have an opportunity sitting in the center of these two worlds to gather the heads of the corporate investment arms, having them really present and intentional so that you can very intentionally help that matchmaking. Because
Yes.
collisions by chance, it takes forever, right? And if we're dealing with founders who are introverts, it may never happen, right?
So I have some thoughts on it. I've been in technology-based economic development off and on over the years. And you're right, states like California does not have an organization like us that puts money into companies because there's plenty of money floating around. Instead, their organization is focused on matchmaking. Massachusetts, same way, North Carolina, or New York to a certain extent. What you see, what I tend to think, it depends on what region you're in and what are the best things that can catalyze this environment. So here, the thinking was, and other, we'll call them, unfortunately, states that are largely ignored by some of the larger venture investors, there's more activity on putting money into companies, more activity. When I was in BioGenerator, I had to form the companies in St. Louis. Now, form the companies, find management, put money into them, and actually do everything you had to do to create the companies. Here, companies are being formed through folks such as you, and our job has been to put money into them. But I agree, we need to do a better job of trying to make these connections for our companies, if possible.
Okay, if there's any more questions, we need to move on to our presenter.